You know, if you break a bone, the diagnostic process is just incredibly
Also,
straightforward.
yeah, completely.
Right. You go to a clinic, they take an x-ray. The doctor points to a jagged white line on the black screen. It's binary. It's either broken or it's not.
Very clear cut.
But when you step into the world of human sexual health and specifically neurobiology, that x-ray machine becomes entirely useless
Oh, absolutely useless.
because you are suddenly navigating this landscape where the physical body and psychological state are so intimately tangled up, it is almost impossible to tell where one ends and the other begins.
Right, the line is just blurred.
Exactly. And welcome to the deep dive, by the way. Today is Sunday, July 5, 2026.
Sure.
And I know you, the learner listening right now, you love a thorough, balanced exploration of complex topics. So today our mission is to unpack a really fascinating and honestly a highly counterintuitive question,
It really is.
which is, can anxiety about sex actually increase a woman's perceived physical looseness?
It sounds like a contradiction, right?
It really does.
Okay.
And to figure this out, we're pulling from a huge stack of sources today. We've got medical texts on the biology of female sexual function, psychological lab studies from the University of Texas looking at the sympathetic nervous system, physical therapy guidelines for the pelvic floor, and clinical data on anxiety disorders. So we have a lot of ground to cover.
We do, yeah. And to really unravel that mind-body paradox, we have to start by looking at the literal physiological architecture of human arousal.
Okay.
Because we tend to think of arousal as just an emotional state, But underneath that feeling is a highly orchestrated cascade of essentially plumbing and electrical signals.
Right.
So if we look at the baseline anatomy, the vagina in an unaroused state isn't just like an empty passive space.
Because it's just a tube.
No, exactly. It is a cylindrical organ composed of 3 distinct layers, including a muscularis layer made of smooth muscle fibers. And in a normal resting state, those muscles are actually holding a baseline contractile tone.
Okay, so they're slightly flexed.
Yes, they are actively maintaining structure.
So even before anything happens, the body is doing work just to keep everything supported.
Precisely that. And the changes only begin when the nervous system registers sexual stimulation.
Which is the electrical signal.
Right. It sends a signal that triggers the release of specific chemical messengers, primarily nitric oxide and vasoactive intestinal peptide.
Okay.
And that nitric oxide tells the local blood vessels to dilate rapidly. So you get this massive and sudden surge of capillary blood flow directly to the pelvic region.
Just a cold rush of blood.
Exactly. And this localized swelling is so intense that it actually overwhelms the tissue's normal ability to reabsorb sodium. As a result, fluid is basically pushed out through the walls of the tissue.
Oh, wow.
Yeah, and that is what creates natural vaginal transit or lubrication.
Wait, hold on. Let me, I'm trying to visualize this structural shift because as all this blood is rushing in and the tissue is relaxing and expanding to accommodate penetration, how does swelling actually make things tighter?
Right, that's the big question.
Because shouldn't a rush of blood and fluid make the whole area wider and, well, looser?
You would think so, but the mechanism behind that is actually one of the most misunderstood parts of female anatomy.
Oh, really?
Yeah. The arousal cycle happens in distinct phases, and the geometry of the space actually changes depending on where exactly you look.
Good.
So during the initial excitement phase, the inner 2/3 of the vagina, so the part deepest inside the body, that part does indeed lengthen and expand. It balloons outward to make room.
Right, that makes sense.
But what happens next in the plateau phase, which is the high level of arousal just before orgasm, is entirely different. And this is the key to our entire discussion today.
Okay, I'm listening.
In that lower 1/3 of the vagina, right near the entrance, a temporary structure forms called the orgasmic platform.
The orgasmic platform. Okay, let's unpack this because this feels like the missing puzzle piece that, nobody ever talks about in basic biology class.
It is remarkably under-discussed, I agree. So during this plateau phase, the blood swelling, the vasocongestion, it becomes intensely focused in the perineal and bulbocavernosus muscles surrounding that lower third of the vagina.
Okay.
As those tissues gorge with blood, they thicken significantly. And because the space is confined, that thickening expands inward.
I see.
Yeah, it dramatically decreases the transverse diameter of the opening. The biological purpose of this is to naturally create a narrowing and increased tightness that maximizes friction during intercourse.
Okay, so the arousal process is almost like setting up a tent.
A tent. Okay, I like that.
Yeah, like the inside elongates and expands to make room for the structure, but the entrance itself actually tightens up, almost like pulling a drawstring on a bag to secure the base and create that necessary friction.
That visual captures the mechanics perfectly.
Yes.
And the most important takeaway here is understanding what actually controls that
The
drawstring.
nervous system, right?
Exactly. The formation of the orgasmic platform is fundamentally a neurovascular event. The physical hardware is all there, ready to go, but it absolutely requires the nervous system to run the software. The brain has to give the explicit green light for blood to flow and engorge those specific tissues.
Which naturally leads to the big question for today. If the nervous system is the control center for this biological drawstring, what happens when the brain is suddenly hijacked by panic or anxiety?
Right.
Does the software just crash and prevent the tent from being set up in the first place?
To answer that, we really have to look at what scientists call the autonomic paradox.
The autonomic paradox.
Yeah, because for decades, the medical and psychological fields, they operated under a very rigid, simplistic assumption about how the nervous system interacts with sex.
Like a binary on-off switch?
Kind of, yeah.
Yeah.
So we have two main branches in our autonomic nervous system. There's the parasympathetic branch, which controls our rest and digest functions.
Okay.
And then there's the sympathetic branch, which is our fight or flight mobilization system.
So the sympathetic system is what floods you with adrenaline when, like, a car swerves into your lane on the highway.
That's the one. And for about 30 years, the prevailing scientific assumption was that the sympathetic nervous system strictly inhibited female arousal, while the parasympathetic facilitated it.
Because relaxation is good for sex.
Exactly. The logic seemed perfectly sound. Relaxation equals good for sex, stress equals bad for sex.
When researchers finally decided to, put that assumption to the test in the lab, the data showed something entirely backward.
It really did. The breakthrough came from research conducted by Dr. Cindy Meston at the University of Texas. She designed these studies to artificially activate the sympathetic nervous system in female subjects to see how it impacted their physical arousal when they were exposed to erotic material.
Wait, how do you artificially trigger fight or flight in a lab?
Well, in one study, she had subjects engage in intense, acute physical exercise to get their heart rates up.
Oh, smart.
Yeah, and in another, she used a stimulant, specifically ephedrine. Then the researchers tracked the physical response by measuring the vaginal pulse amplitude, so the blood volume in the vaginal tissue.
And what did they find?
What they discovered was a curvilinear relationship. It was not a straight line where more stress automatically meant less arousal. In fact, moderate activation of the sympathetic nervous system actually increased vaginal pulse amplitude and physiological arousal.
Wow.
Yeah, a little bit of that fight or flight energy, a little bit of physical stress actually primed the body and facilitated the arousal cascade.
Okay, here's where it gets really interesting. Because I am genuinely stuck on this.
What's the sticking point?
If a moderate amount of fight or flight stress is actually a good thing that boosts physical arousal, why does performance anxiety completely kill the mood? Because anxiety is fundamentally a sympathetic nervous system response, right? Why doesn't it give the body the same boost that a quick workout would?
That is the perfect question. And the difference lies in the threshold of threat detection. To understand that tipping point, we have to look at polyvagal theory. Polyvagal theory goes beyond that simple two-part system of rest and fight or flight. It actually identifies three distinct physiological states that our bodies move through.
3 states, okay.
Right. The foundational state is the ventral vagal state. This is when your body feels safe, secure, and open to social engagement and connection.
That's the ideal.
Yes. The second state is the sympathetic state, which is mobilization. This is your moderate stress, your excitement, your exercise.
So that's the workout boost.
Exactly. And the third state is the dorsal vagal state, which is the ultimate emergency brake. It is freeze, dissociation, or complete shutdown.
So if I'm understanding this correctly, the moderate stress from a workout or, I don't know, watching a thrilling movie, that is just sympathetic excitement.
Right.
It's energy, but it's not a mortal threat.
Yes. The body is mobilized, but it still has a foot in that ventral vagal state of baseline safety.
Okay, I see.
Genuine erotic presence, the ability for the body to completely surrender to the vulnerability of the arousal cascade, it absolutely mandates that underlying feeling of safety.
Which anxiety destroys.
Exactly. Here is where anxiety changes the equation. If a person is experiencing intense anxiety about sex, whether it's performance anxiety, fear of pain, or like body image panic, that anxiety pushes them way past moderate arousal.
Right.
The brain's threat detection system dials up to maximum, and when that happens, the nervous system completely abandons safety and rapidly shifts into that third state, the dorsal vagal shutdown.
Wow. Because if the brain believes it is in genuine imminent danger, it is going to hoard its resources.
Exactly.
It's certainly not going to prioritize sending massive amounts of blood flow to the pelvis to form an orgasmic platform.
Yeah.
It's just trying to survive.
The brain's survival mechanisms will always override the reproductive system. And the impact isn't just in the moment either.
What do you mean?
Well, chronic anxiety and stress alter the body's internal chemistry long term. When the body is constantly swimming in stress hormones, it can actually lower estrogen levels, which directly reduces natural lubrication and tissue elasticity. High anxiety makes genuine, embodied presence physically and chemically impossible.
So when that nervous system shutdown occurs, the physical cascade of arousal just halts in its tracks. The software essentially refuses to boot up.
It crashes.
And this is exactly where we arrive at the core of our question today, the sensation of physical looseness.
Yes, and connecting this back to the anatomy we discussed earlier makes the mechanics of this illusion very clear.
Okay, lay it out for me.
Because high sexual anxiety triggers a nervous system shutdown, it completely blocks the physiological arousal cascade. The brain withholds the signal, and because the signal is withheld, the intense vasocongestion never happens.
Right, the blood doesn't flow.
Exactly. The tissues in the lower third of the vagina do not gorge with blood, which means the orgasmic platform never forms.
The biological drawstring never gets pulled tight.
The physical reality is a tangible lack of expected friction. The narrowing simply does not occur.
That is wild.
But the phenomenon doesn't stop with just a physical absence. Clinical data on anxiety disorders introduces another highly insidious factor into this equation, a psychological phenomenon known as hypersensitivity, or discomfort awareness.
Oh, I want to dig into this because it sounds incredibly frustrating to experience.
It is.
Hypersensitivity basically implies that the brain is actively making the situation feel worse than it is, right?
The anxious mind operates like an aggressive amplifier. When a person is in a state of high anxiety, the brain starts scanning the body for proof that something is wrong.
Looking for danger.
Exactly. It takes completely normal or maybe slightly altered bodily sensations, like a slight decrease in friction because the platform hasn't fully formed, or a subtle lack of moisture, and it focuses on them with such intense scrutiny that it magnifies their severity.
Oh, wow.
A 10% reduction in friction suddenly feels like a total structural failure to the anxious brain.
That creates a feedback loop from hell.
Oh, a total nightmare.
Because think about it. You start out anxious, so your nervous system puts a block on the blood flow, meaning the orgasmic platform doesn't form.
Right.
Then your hypersensitive brain notices the lack of friction and immediately assumes the worst. It thinks, there is something structurally wrong with me. I am physically loose.
Yes.
And that horrifying thought triggers a massive spike in panic, which signals the nervous system to restrict blood flow even further, making the physical situation even worse.
It is a self-fulfilling prophecy orchestrated entirely by the autonomic nervous system. The brain creates the exact physical conditions it is afraid of.
Okay, let's clarify something really crucial for anyone listening who might be wondering about this for themselves or a partner.
Sure.
In that moment of intense anxiety and lack of friction, are they actually physically loose? Is there something wrong with their body? Or is this entirely a software glitch where the hardware is perfectly fine, but the program is just frozen?
Making that distinction is absolutely vital for treatment. What we are describing here is almost entirely a functional issue.
Okay.
It is a software block. This is fundamentally different from structural vaginal laxity.
Just to differentiate, structural laxity would be the physical changes that occur after something like traumatic childbirth, or the natural loss of collagen and estrogen associated with menopause, right?
Yes, exactly. In cases of structural laxity, the actual collagen and elastin fibers in the outer fibrous layer of the tissue have been stretched, torn, or chemically degraded.
So the structure is actually changed.
Right. The physical tissue itself has permanently lost its intrinsic tone or changed shape. But with anxiety-induced looseness, the anatomical structures are completely intact.
They are fine.
Yes. The muscle tone is there. The vascular pathways are perfectly healthy. The hardware is completely capable and simply waiting for the signal. But the anxious brain has thrown up a firewall, blocking the vasocongestion required to create that temporary functional tightness.
You know, that distinction alone has to be incredibly liberating to realize.
It's a game changer for patients.
Because if you are dealing with a software issue, you don't necessarily need a permanent hardware upgrade or surgery. You can rewrite the code.
Yes, you can.
And the clinical literature provides some highly effective, evidence-based ways to break this vicious mind-body loop, utilizing both psychological and physical therapies.
The protocols for rewriting that code are fascinating because they attack the problem by essentially tricking the nervous system into feeling safe again.
How do they do that?
Well, on the psychological side, one of the most robust clinical interventions is a therapy called sensate focus.
Sensate focus. I have to admit, I always assumed sensate focus was just a clinical buzzword for, spending more time on foreplay.
That is a very common misconception.
But looking at the actual methodology and the sources, it is a highly rigid prescribed protocol.
It is intensely structured, and for very good reason. Sensate focus was developed specifically to dismantle performance anxiety. It involves a couple committing to spending 20 to 60 minutes, 2 to 3 times a week, engaging in very mindful, non-judgmental physical touch. But the critical mechanism that makes it work is that it happens in strict incremental stages.
Strict stages.
Yes. During the initial stages, genital touch is explicitly forbidden.
Wow. So you remove the main event entirely.
Completely. The goal of the first stage is purely tactile exploration of non-erogenous zones. Arms, backs, legs. You are not trying to arouse the partner.
Or just touching.
You are just feeling the texture of their skin, the temperature, the pressure. By explicitly banning genital touch and intercourse, you completely remove the goal. And when you remove the goal, you eliminate the pressure to perform.
It's exactly like booting up a computer in safe mode.
Safe mode. I love that analogy.
Yeah, like when a computer's crashing, you don't try to run your heavy, complex video editing software. You reboot in safe mode, where only the absolute basic essential functions operate.
Sensate focus strips away all the high-pressure expectations of penetrative sex and climax and just tests the most basic hardware of human touch. And it keeps doing that until the nervous system realizes there is no threat, and it trusts that it's safe to operate again.
If we connect this to the bigger picture, that process of systematic desensitization is exactly how you coax the nervous system out of that sympathetic fight-or-flight panic and guide it gently back into the ventral vagal state of safety and connection.
Right.
You are literally teaching the brain to process physical intimacy without sounding the alarm bells. But while you are recalibrating the software through sensate focus, you can simultaneously fortify the hardware.
Okay.
And that brings us to pelvic floor muscle training, or PFMT.
Now, when we say pelvic floor training, most people immediately think of Kegels, right? Like the kind of casual squeezing you do while waiting at a red light.
Right, the casual squeeze.
But the physical therapy guidelines describe something much more intensive. Clinical PFMT is a far cry from a casual squeeze. It is rigorous strength training of the levator muscles, which essentially form a muscular trampoline at the base of the pelvis.
That's trampoline. Okay.
The goal is to build structural support and stiffness in this levator plate, providing a rock-solid backboard for the pelvic organs and the vaginal canal. When those muscles are strong, they naturally enhance the contractile tone we talked about at the very beginning.
But there is a massive hurdle that the physical therapy texts point out. Apparently, over 30% of women cannot correctly contract their pelvic floor muscles on the first try, even when a professional is verbally guiding them.
It's true. And it makes sense because it is a hidden muscle group.
Right, it's not like an arm muscle.
No, you can't look in a mirror and watch it flex the way you can with a bicep curl.
Yeah.
And because they can't feel the specific muscle, many patients will accidentally bear down, flexing their abdominals or their glutes instead.
Which is bad, right?
Very bad. Bearing down actually increases intra-abdominal pressure and pushes down on the pelvic floor. It does the exact opposite of what you want and can significantly worsen pelvic floor dysfunction.
Oh, wow. So how do they fix that?
This is why clinical interventions like biofeedback are so essential.
How does the biofeedback actually bridge that gap?
By making the invisible visible. A physical therapist will use a vaginal pressure sensor or electromyography. The patient can look at a computer monitor in real time, and when they attempt to contract the pelvic floor, they see a graph on the screen.
Oh, so they get instant visual confirmation.
Exactly. If they use their abs, the line stays flat. When they finally isolate and squeeze the correct levator muscle, the line spikes. It forcefully connects the brain back to the specific muscle, creating a new neural pathway.
And once that connection is established, the sources emphasize a specific functional technique called the knack,
Yes.
which sounds like a magic trick, but it's really about intentional timing.
The knack is incredibly practical. It's a voluntary counter-bracing contraction. Once a patient knows how to find the muscle, they are taught to intentionally squeeze and lift the pelvic floor just milliseconds before and during any physical exertion that increases abdominal pressure.
Like coughing or sneezing or lifting a heavy box.
Precisely. They brace the trampoline before the weight hits it. And mastering this technique doesn't just build muscle, it gives a patient a profound psychological sense of physical control over their own body.
If we zoom out and look at this as a combined strategy, you integrate the psychological SACE mode of sensate focus with the physical empowerment and mapping of pelvic floor muscle training.
Right.
You are attacking the anxiety feedback loop from both directions simultaneously. You are calming the software panic and proving to the brain that there is no threat, while simultaneously proving to the patient that their physical hardware is strong, capable, and entirely under their control.
You are restoring the ventral vagal state of safety while physically optimizing the exact muscle groups responsible for supporting the orgasmic platform. It is a really comprehensive reboot of the mind-body connection.
We have covered an incredible amount of ground today, peeling back the layers on a topic that is shrouded in so much unnecessary mystery. So let's recap the core of what we've discovered. Can anxiety about sex increase a feeling of physical looseness?
The answer is a definitive, scientifically backed yes.
But it is vital to understand how it happens. It is not because the body's permanent physical structure has somehow degraded or failed.
Oh.
High anxiety acts as a threat, hijacking the autonomic nervous system.
Yes, that panic prevents the specific intense blood flow, the vasocongestion, that is required to inflate the tissues and form the orgasmic platform. The biological narrowing never occurs.
Meanwhile, that exact same anxiety creates a hypersensitivity in the brain, turning up the volume on every physical sensation, making you fixate on that lack of friction. It creates a miserable self-fulfilling loop where the brain causes the physical absence and then panics over the result.
It is a functional suppression of the arousal cascade entirely driven by the nervous system, not a structural failure of the anatomy.
And for you listening, understanding that difference is what changes everything. When you realize this is a functional glitch, it takes the shame completely out of the equation.
It absolutely does.
It proves that this kind of sexual dysfunction is not a moral failing, and it is not a sign that your body is permanently broken. It proves that the mind and the body are a single, intimately connected circuit. Your brain and your pelvis are having a constant conversation. When you understand the machinery and the software running it, you can rewrite the code and fix the glitch.
You know, before we wrap up, there is one final, highly provocative insight buried in the crossover between our physical therapy and sports medicine data.
Oh, what is it?
We discussed earlier that moderate exercise can boost arousal by lightly engaging the sympathetic nervous system.
Right, the Cindy Meston studies.
Right. But the clinical data on pelvic floor health shows that high-impact exercise things like intense jumping, heavy weightlifting, or gymnastics creates ground reaction forces that can equal up to 16 times a person's body weight.
Wait, 16 times your body weight slanting down onto that pelvic floor trampoline with every jump.
Yes. 16 times. And over time, this extreme, repetitive physical stress can physically tire out, overstretch, and weaken the levator plate.
Wow.
But not only that, it simultaneously forces the body into a state of chronic sympathetic nervous system overdrive. The body is constantly in a state of high physical stress.
That is fascinating.
It really raises a question for us to ponder. Could our modern cultural obsession with extreme high-intensity fitness routines be inadvertently creating the perfect storm?
Like, are we physically exhausting the pelvic hardware while simultaneously burning out the nervous system software, inadvertently contributing to the exact conditions that cause these sexual dysfunctions?
Are we constantly putting our bodies in such a severe state of fight or flight for the sake of fitness that the nervous system simply forgets how to feel safe enough to engage in intimacy?
That is a profound thought to leave you with. Think about the hidden toll on your nervous system the next time you're deciding between a brutal, high-impact workout and a restorative yoga session. Remember that X-ray machine we talked about at the very beginning? When it comes to human arousal, you cannot just take a snapshot of the bones and muscles and get the whole story. You have to look at the invisible electrical currents, the nervous system that holds it all together. Thank you for joining us on this deep dive. Keep questioning the assumptions you have about your own biology, keep learning, and most importantly, view your own body with a little more grace and a lot more curiosity.